mentioned yesterday, we have 3 steps. So the first step is building the assessment matrix, the second step is costing, and the third step is how to ensure that the recommendations are endorsed by the government and to do a little bit of advocacy, etc., so that the report is not only a report, but it's useful, yeah? So the main tool that we are going to use today for this first step of the assessment-based national dialogue is the matrix. So you have a big version here behind me, and this is the version that you will use during the whole day. So as you can see, we have the 4 guarantees of the social protection floor. Under each guarantee, the idea is to describe what exists in the country in terms of social security schemes, social protection provisions. So here you can enter contributory social insurance schemes, you can include cash transfer, you can include even safety nets, etc. You can include whatever exists in the country for health, children, working age, and the elderly. This is the normal matrix that we are using. Since we have a very big group today, we split in 6 groups. Instead of having only 4 groups, we split in 6 groups. Huh? So we have health, we have HIV, which is usually inside health. We have children, we have working age, we have maternity, and we have the elderly, okay? So each of our groups, during today's and tomorrow, and so the people from the group on maternity, they will work more specifically on maternity, yeah? And so you will have, we will give you a case study of a country, yeah? It's not a real country, it came from the imagination of Loveline, and it is called Croatia, and you will have to identify what exists in terms of maternity provision in this country and put it in the matrix. Yeah? And then also what is interesting to see is to see whether the government has a strategy to extend existing schemes. So it's always interesting to put in the matrix ongoing discussions, what is in the strategy already, although it has not yet been implemented. Because usually when you do recommendations, you should ensure that these recommendations are in line with the government strategy, of course. If you propose something which is completely different from the government strategy, you have almost 100% chances that these recommendations will not be listened to. Yeah? And then we look at policy gaps and implementation issues. I will explain just after what is the difference, but you have already a sense, thanks to the Jeopardy game, there was a question on that. And recommendations. So to complete the assessment matrix, there are different, there is a whole methodology that you can use. Of course, the first thing to do is to read all available reports on the country, social security, social protection situation in the country, the description of the different schemes. You can also, it's really important to do the review of all the legal framework, and for that, I mean, for us, when we're working in a country where we don't understand or we cannot read the language, it's really challenging. This is also why we work with a national counterpart, so that we can really have access to the legal framework. For Thailand, it was really for us a bit challenging, yeah? Because it's not only the biggest laws, it's also all the decrees, the regulations, so it's quite a big work. Huh? And then what is important is to get a sense through bilateral consultations with ministries, so all the different ministries, all the different stakeholders, social security institutions, workers, employers, etc., and civil society, to get a sense of what exists according to them. If you have a civil society organization working only on the elderly, such as HelpAge, they have like tons of information to share on existing situation, the gaps, the problems, etc. So all this information is very often not written, no? So you really need to go and capture this information by talking to people. And then what is important is to put all these people together. And usually when we organize these workshops, national dialogue workshops on social protection situation, on filling together the matrix, the assessment matrix, it's interesting for the participants, because sometimes it's the first time that they sit together with the other ministries, with other institutions. Many of them tell us, oh, it's the first time that we think across ministries with my counterparts from this other ministry or this other institution about the problems of social protection in our country. Yeah? And from these discussions, you get a lot of new ideas as well. And here in the case of this scheme, we know already that more than 70% of the target group, of the elderly in Thailand are covered. And the benefits, so before the benefits it was easy, it was 500 baht per month, but now they have changed the level of benefits. Now it's 600 baht when you are 60 to 69, 700 baht when you are 70 to 79, 800 baht when you are 80 to 89, and 1,000 baht if you are above 90 years of age. Yeah? And it's financed by general tax revenues. Okay? Through this kind of table, you can describe any type of scheme. You can also describe social insurance schemes, for instance. So now, in the matrix, you have the description of existing schemes, and then you have to identify policy gaps and implementation issues. So this is a very preliminary definition of a policy gap. So it's when there is no law, a missing legislation, or a policy which leads to the exclusion of a share of the population from some parts of the floor. For instance, if you have a law on social security, and all the informal sector are not included in the law, yeah? And there's no other policy for informal sector. There's no other schemes or laws or regulations targeting specifically informal sector. For us, it's a policy gap. Yeah? Okay. Can you give me a few examples of policy gaps from your own experience in your countries? Who has an idea? An example, a concrete example from your country. Dr. Kanya, for instance. Are there policy gaps in Cambodia?
Yes, concerning to the healthcare financing, that in our country we don't have any policy for now the process of the development health financing policy still in draft. So we concerning to the policy, we mentioned on the financing proposal side, demand side, and supply side. For the new policy, we intend to shift financing to the demand side much more than supply side. This is what the gap that in our country has been.
And there's not yet, is there already some laws on social health protection, for instance, beyond the policy?
Concerning to the legislation, now still fragmented. We have some existing like National Social Security Fund and National Social Security Fund for civil servants still in draft, not yet approved. And for the informal sector, we don't have. Even institution also, for informal sector, we don't have. We still implementing like program based. So during the development policy, our recommendation, we strongly recommend to the government that to establish the national institution. In our policy, we suggest that two options. One, implementing for the short to medium term, and second is for long term, to reach universal coverage policy.
Thank you. Okay, so just to give one or two examples, for instance, if in a country only formal sector workers and the very poor are entitled to social health protection, it means that the rest of the informal economy, which are not poor, are not entitled to social health protection, so there is a clear policy gap. Yeah? All right? This was, so far, I think, we can say it was the case until now in Indonesia. Yeah, until now. I think things are moving now in Indonesia. Huh? But you had schemes for the formal sector, you had schemes for the very poor through Japanese mass, but you didn't have really a clear law or policy or a scheme for the rest of the informal sector. Another one is, for instance, for small children, only formal sector workers are entitled to a child allowance for their preschool children. This is the case in Thailand, for instance. Huh? There is a child allowance for preschool children for formal sector workers, but not for the rest of the country. Another scheme which is very, very common, another policy gap, is that there is no unemployment protection in case of loss of employment for all workers. This is the case in all the countries where you have nothing in terms of unemployment protection. So actually you can find many other policy gaps. These are just a few examples. For instance, if you have a share of the population which is not covered by the law, it's a policy gap, by all the different laws pertaining to social security. And usually, very often, those who are not covered are informal workers, sometimes dependents as well, and some special vulnerable groups. Then you can have a policy gap when the levels of benefits are really insufficient to guarantee income security, because our objective is to have income security. We had a question on whether the lump sum payment upon retirement provides enough protection, and the answer during the Jeopardy game was no, because the lump sum, you just use it and then you have no income security, correct? In a country where the pensions, for instance, are not indexed on inflation, for us it's a problem as well. And this is written in the law or the decree, so it's a policy gap. If you want to change that, you have to change the legal framework, yeah? Also, the benefit package sometimes are not adapted to the needs. And here again, this is written in the decrees of implementation or in the law itself. For instance, if you have a country like Indonesia where people are scattered, we have a lot of islands, I think 17,000, correct? 17,000 islands in Indonesia. And the healthcare centers, of course, are not in each island, yeah? So if you don't cover transportation costs in case of healthcare emergency in your benefit package, it's a policy gap, because obviously there is a need to cover this kind of needs. In some cases, the lack of clarity can be considered as a policy gap. For instance, if you have a benefit package which is not specific, we cover everything. You go to the health center, everything is covered. But in reality, if there is no clear definition of a benefit package, it's very difficult for the beneficiaries to say, yes, I'm covered for that, I'm entitled to receive that. Because there is no clarity. Yeah? So for us, it's a policy gap as well. In some cases, you have a law, a very nice law, but you have no decrees of implementation as well. So the law is just sitting there, and nobody's implemented because there's no degree of implementation. This is an obvious policy gap. Another case, when there are problems of, there's no portability of the pensions, for instance. So there is a pension scheme, so you can, during, let's say, 5 years, 10 years, contribute to a pension program, and then you change employer. You are still under the same pension scheme, but since you have changed employer, the pension doesn't go with you to the other employer. You're entitled to pension. So you will receive a small lump sum because you have contributed for 5 or 10 years. But in the end, even if you have worked for 40 years in the private sector, you will not receive a proper pension. Yeah? This is for us a policy gap. So you can see that policy gaps, it's not just, is there a law or a decree, or there is no law or there is no decree. It's a bit more complex. And then implementation issues. Implementation issues, it's the case, the situation where you have the law, you have the decree, you have everything, but the scheme is not in place or is only partially in place. So the tentative definition is, despite existing policy or legislation, the effective access to social protection, to the guarantee, has not yet happened. Can you give me an example? There is a lack of enforcement of the Social Security Act due to low compliance among employers to register their staff. Yeah? And also, in the case of Thailand, for instance, where the Social Security Act applies also to the informal sector workers, so it's in the law, yeah? But it's a voluntary scheme, and the Social Security Office has to run after the informal sector workers so that they register and they pay regularly their contributions. So this is a huge work, and so it's very difficult for them also to implement the law. So the law is there, but there is an implementation issue due to many things, including a lack of resources to reach out informal sector workers. Yeah? Also another one is, despite universal access to social health protection, people from rural areas have only limited protection due to poor healthcare infrastructure. I think we discussed that already several times. You have a beautiful scheme, a health insurance scheme, which covers everybody, but in rural areas, the health facilities may not be of the proper quality, and therefore people don't really have access. Okay? So here again, implementation issues, you have different types. So the law enforcement, we said it already. No? This happens very often. Supply side shortages, this is just what I said. No? You have the social health insurance law, but no the health centers, so people don't really have access. There is also a problem related to lack of communication, awareness raising. Sometimes people are covered, but they don't know that they are covered, or they don't know how to register so that they can be entitled to the benefits. Yeah? This is a problem of communication, information. Then also fragmentation of schemes leading to some inefficiencies. Sometimes you have, this is the case maybe in many countries where you have a lot of anti-poverty programs, social assistance schemes from each ministry, like in Indonesia, for example, you have a lot of anti-poverty programs, but there is a lot of waste in terms of energy and administrative processes, because each scheme has its own administrative procedures, instead of trying to merge the common administrative procedures so that they can concentrate their efforts on other things, they just duplicate. You know? So this is not a policy gap, it's really an implementation issue. You know? And ineffective monitoring and evaluation system, so that we don't really know who is covered and which schemes are really implemented. So when you do this exercise, it's important to keep in mind that you have in all countries some special groups which are particularly vulnerable and are very often either excluded, or if they are not excluded from the law, as Tovik explained, in the practice they are excluded. These groups are people with HIV or people with specific diseases, migrant workers, refugees. We have someone from UNHCR here who will be able to talk a lot about refugees. People with disabilities, people who are indigenous or don't have any citizenship, and in some cases women for some types of schemes. So this, we saw it yesterday. We will have, once you have done the description of the schemes, the policy gaps, implementation issues, then you come up with recommendations. Here, please put all the recommendations that you wish, okay? Qualitative, quantitative, creation of a new scheme, improvement of the supply side for healthcare, if you are in a healthcare group, put everything, you know? And then we will try to see which of the recommendations we can then cost with the costing tool. Okay? You really have two types of recommendation, but don't limit yourself to recommendations that are only related to increasing a little bit the level of benefits. Okay? This is not interesting. What is interesting is really to think about all what can be done in the country of Croatia. Yeah? Okay. I leave your